Welcome to the Way Forward webinar brought to you by the US Heartland China Association. My name is Min Fan. I'm the Executive Director of the US Heartland China Association. The topic today is nursing in Greater China and the US in 2020. I want to quickly mention that US Heartland China Association is an association of members, donors, and community organizations that support US-China relations, a strong, productive one, and check out us on the website. I also want to mention our sponsor today, Guardians of the Angeles Charitable Foundation, whose generosity made this public program possible. They also donated over 100,000 PPEs to clinics, cities, schools all around the Heartland region. So thank you, Guardians of the Angeles Charitable Foundation. We also want to thank our co-organizers, Eastern Michigan University, Greater Columbus Chamber of Commerce, and Million Women Mentors from Tennessee and Tennessee China Network for getting the word out. 2 housekeeping items. Throughout the event, please feel free to submit your questions. We did get some questions before the event, so our panelist speakers will try to address them through their presentation. And also at the very end, when you leave the webinar, there will be a very short, quick survey popping up. Please tell us what you think and give us your feedback. Now let me turn to our special guest, Dr. Jim Smith, President of Eastern Michigan University, who gave us his opening remarks. So really quick, Dr. Smith is a member of our association. His university is a member of our association, and he's been a longtime advocate for US-China collaboration on education. Dr. Smith, the floor is yours.
Thank you, Min. Hello, everyone. Ni hao. Thank you for being with us this morning, this afternoon, this evening, no matter where you are around the globe. I want to begin by thanking Governor Holden and Min Fan for all their work in bringing these webinars to life. I hope you've been able to see other ones, excuse me, hope you've been able to see other ones throughout the last few months, and I look forward to those that are forthcoming as well. Nearly a year ago, Governor Holden and I spoke about doing a seminar like this in person on the Eastern Michigan University campus. We wanted to bring great minds together to talk about issues around nursing, both nursing practice and nursing theory, and to look at the US and China perspective. Well, here we are a year later, all virtual, making this come to life in the midst of one of the worst pandemics in 100 years. That being said, Eastern Michigan's honored to be a part of this webinar today, and we're proud of our collaborative work that we're doing throughout China. From Wuhan to Nanning, from Nanning to Shenyang, Shenyang to Tianjin, and many more. We have a few partnerships that are developing as I speak this morning, and we're excited about all the existing partnerships and those that are developing. I want to thank you for allowing me to share just a few words this morning, and I want to let you know that you're all welcome to the city of Ypsilanti, just 20 minutes from Detroit International Airport, post-pandemic. We greatly enjoy having you with us. We'd love to have you meet our students from 80 plus countries that make Eastern Michigan University a diverse and a globally centric university. Before I close, I want to just say a few words about our outstanding faculty member who will speak in just a few minutes. Dr. Su-Yen Wu is the 2020 Robert Wood Johnson Foundation National Civic Health Equity Award winner. She's also the driving force for EMU's Health Disparity Project. And I can say from a personal perspective, she's a wonderful person to travel with virtually anywhere around the globe. I know you'll appreciate the comments of all of our presenters, but I would be remiss not to take a second or two to speak about one of our truly outstanding faculty members and all that she does for not only Eastern Michigan University, but for Greater Detroit, all of the state of Michigan, and her work throughout the world. Min, thank you again for having me this morning. I look forward to the webinar. Xie xie.
Oh, thank you. Thank you, Dr. Smith, for your wonderful remarks. Your championship for collaboration between the Heartland region, education institutions, your faculty and students are phenomenal. We're really honored to have one of your students in our student forum in October. We look forward to featuring your school in January in our student forum in January. So thank you. And now I'm going to turn to our 3 very special speakers. Dr. Pam Cipriano, Sui Grand Clement, and Dr. Tsuyin Wu. So without going into too much detail of their very extensive, impressive background, I'm going to actually turn to each one of them to share with you their background and the organization they represent. And let's see. And first, I'm going to start with Pam. And Pam, would you like to share with us your background and your story?
Thank you, Min. Yes, I'm really pleased to be with these distinguished colleagues and to have an opportunity to talk with everyone today. Currently, I am the Dean at the University of Virginia School of Nursing in Charlottesville, Virginia. These are our two buildings. There's not many people around these days as our students are doing some remote learning and of course doing their clinicals, and many of our faculty are working remotely too. And if you'd show the next slide, Min. We're really pleased that we are a distinguished school of nursing in the United States, the #1 school in Virginia. We have 5 different degree programs, from our bachelor's program to our master's entry, master's, which is where our nurse practitioner programs are housed, our doctor of nursing practice, and PhD. We're considered a medium-sized school with a little over 800 students, about half being graduate, half undergraduate. Next. And this is our medical center. We do have several other hospitals, but this is our main organization within Charlottesville, right across the street where our students do most of their clinicals. And so we are very pleased to have a distinguished medical center. Actually, just yesterday, we also learned that we were redesignated by ANCC for magnet recognition. So we were very excited to be able to celebrate that. And our next slide, please. And just to tell you a little bit about myself, I started very early as a student being involved in nursing organizations, which led me to early on in my career be an officer in the American Nurses Association. Many years later, after having been a staff nurse, a clinical nurse specialist, and then gone on to management roles, I ran for president of the American Nurses Association and was honored to be elected and served 2 terms, which really gave me an incredible opportunity to represent the interests and needs of nurses, particularly in the United States, but then also as the U.S. representative within the International Council of Nurses. The last decade has had many issues where nursing's voice has been incredibly important, and so I've been very honored to be able to speak out, to be represented in the media, and to be able to spread the voice of nursing. Last slide, please, Min. And so I would just share with you that my career now has also turned to being involved as first vice president of the International Council of Nurses. So I'm really excited that I can continue to work on the issues that are important, amplifying nursing's voice, being able to make sure that we continue to really focus on quality, that we influence health policy, the workforce, the work environment, the well-being of nurses, and all of the issues that are so important to us today. So again, thank you, and I'm really pleased to be with everyone today.
Thank you, Pam. We're honored to have you. Next, I'd like to turn to Sue Lee, who will tell us a little bit about her journey and her organization.
Thank you so much, Ming, and thank you so much for the opportunity, and very much looking forward to the robust discussion with the great panelists today. My name is Sue Lee, Grand Clement. Personal facts, I was born and raised as a Chinese Malaysian and spent getting my nursing education in the United States. Currently the Vice President for UPMC International Clinical Operation, and also serving as Chief Nurse and Quality Officer for UPMC China. Every day I have fun job and challenges that you can see listed here in leading clinical quality patient safety operation around the world, and very much looking forward to share with you the exciting story that we've been working on in terms of building an international medical center in China. Aside from nursing, I'm very fortunate to use a lot of my clinical bedside experience and learning about the healthcare system, and landed myself with I call a second career in quality and patient safety. And I'm very fortunate to be, trained and certified and serve as faculty capacity in sharing that body of knowledge. Next slide. I was asked to tell the story about my nursing career. I thought, what's better than a storyboard? It's really funny when I put this together. I was thinking back when I graduated from nursing school, I would have never imagined this sort of places I get to go and this sort of different role a nurse can do. I'm very fortunate beyond just practicing as an advanced practice nurse. at various clinical setting. My setting of practice was also traveling around the world and practicing in a cruise line or in an airplane in medical evacuation assignment around the world. I also had the privilege of working and overseeing the international hospital accreditation operation process for Joint Commission. A picture here, very long time ago, working with a great team of Aga Khan University hospital who's trying very hard at establishing patient safety standard in a very challenging part of the world in Karachi. I have also had the privilege to be trained and lead a team of Lean Six Sigma healthcare process engineer and working on various international and national initiatives related to quality improvement. What can we do to resolve healthcare acquired condition and infections, as well as working with American Heart, American Stroke Association and developing outcome measures to improve the stroke care and heart condition care. I've also had the privilege to serve at many roles in hospital operation leadership capacity, from nursing director to a patient safety officer before I arrived to UPMC. Next slide. And next again, thank you. So many of you probably know a lot about UPMC as a very big healthcare system in the US and also potentially around the world. We have over 40 plus community specialty hospital in the US and a health insurance that cover close to 4 million lives. I think one thing that some of you may know is our very innovative dedication to research and translational science of the work of the UPMC enterprise, where we take real life clinical care experience and transform it into commercial product. Especially in the realm of pandemic, I think one product worth mentioning is our infection control Connect, where we have been doing even before the pandemic, how in terms of understanding access to infection control specialists in different parts of the country and world can be difficult. And what are the technology of digital solution platform can we design to make that access as seamless as possible? Those are some of the great work that UPMC is involved beyond just healthcare and health plan. Next slide. In terms of research and innovation, UPMC and University of Pittsburgh has a long-standing history of discovery in terms of the biomedical research. Go as far as back in 1950 with the first vaccine that Dr. Vassar were invented in terms of the first effective vaccine of poliomyelitis, to the current work of what we're doing in UPMC in terms of looking at the vaccine for COVID-19. That innovation never stops. Next slide. The part or the home that I live in, which is UPMC International, is definitely a very global recognized brand in terms of bringing innovations and research finding and things that we learn at the daily practice and make it accessible around the world. And you can see in the next slide in our presence, next slide. With our UPMC International mission, we really have this firm belief that everyone should have the right and the ability to access the best possible care without having to leave the country. With that vision that started about 20 years ago with the very first hospital in Italy, which is ISMET, at the time we recognized the difficult and challenges of access to transplant care in that part of the country. The hospital was brought together with that vision. And since then, that vision has spread across the entire Italy, to Ireland, to our current longstanding collaboration in Kazakhstan with the Nazarbayev University, and the upcoming work that I'll be sharing with you with UPMC China. So very privileged to be here, and thank you so much for the ability to say hi and share our journey.
Thank you, Sue Lee. Very impressive. Now let me turn to Tsu-Yin, and from our very own Eastern Michigan University. Tsu-Yin, you are on mute.
Good morning, everyone. It's a pleasure to be here with everyone here, as well as my two esteemed colleagues. Thank you so much for having me. My name is Sue-Yin Wu. I'm a professor and also the director of PhD program at School of Nursing at Eastern Michigan University. So I also direct 2 centers, Healthy Asian American Projects, as well as Center for Health Disparity Innovation and Studies. Growing up in Taiwan and came to US for my grad schools, and also later on doing my postdoc from University of Michigan. In my career, there are always moments that I regret the fact that I cannot physically back in there to contribute my expertise. But today I'm so happy to share with you the journey where my work in the US and my roots family came together. And so a little bit about where the work started. Next slide, please, for the health disparity work, by sharing the mission of Healthy Asian American Project, known as HAAP. Established in 1996, HAAP devotes its effort to promote and improve the overall health status of Asian Americans and immigrants in the US, later on expanded to the globally. And currently we have a special focus of our work in Southeastern Michigan. And next slide, please. So this is a little bit about Asian Americans in Michigan. So Asian Americans are one of the fastest growing racial ethnic minority groups, both nationally and in Michigan. And as you can see, the latest kind of growth back from 2010 to 2016, we've seen the 20% of growth in the populations in state of Michigan, which is one of the actually all the group compared to all the group has the highest increase. Next slide, please. So this is the work where we started, and I want to show you this very interesting graph, which I call the invisible Asian Americans. So when we, even though that we see the Asian Americans as the fastest growing populations in Michigan, a lot of times we do not see that reflected or represented in the literature, in the health field, or even the public health. So this is actually the cancer burden graph from the Michigan Public Health report. And as you can see in the chart, there's the green, there's the green for white, there's orange for the black, and there's Hispanic for the light green, but there's no Asian. And that's why that this is truly a problem when HAAP was doing the health events, the health fairs, doing the work in the community. We experienced and we saw the health disparities and the unique needs of this populations, but the other part of the world just did not catch up. Next slide, please. So with the works that we're doing, we find that this is really powerful to use the data to research, to do some advocacy. So subsequently that we are fortunate to receive funding from the state government for the work in the cancer control, breast and cervical, colorectal, as well as chronic disease management that known as PATH, P-A-T-H. Next slide, please. So we also have been very fortunate from the Komen, Susan G. Komen, that funded our local work back in 2011 and 14, that were able to address some of the health disparity in breast cancer and able to provide culturally sensitive language specific intervention for different ethnic groups in Asian groups, as well as Arab and Latino. Next slide, please. And fast track, very fortunate, back in 2018, we received a 5-year CDC funding to address the racial ethnic approaches for community health. The CDIS, Center for Health Disparity Innovation and Study, was established and funded at Eastern Michigan University with a great support all the way from president and all the administration, the grant office. And the mission of our center is to reduce health disparity for underserved populations through service, education, research, and training. And our approach is really to produce a sustainable health outcomes through policy, system, and environment approach. And I wanted to kind of draw your attention to one of the, I'm sorry, the previous one, please. Yes. So this is a dashboard that that in our currently could be available on our website that to show the live real times the COVID-19, because we closely work with the underserved neighborhood in Detroit called Hamtramck. And this is where that what their needs are and where are the cases of the COVID, where are the uninsured people, the percentage why. And there's a map which shows the Hamtramck, you know, to show where to locate the resources that the people could access to. So next slide, please. So CEDAS, you know, has been very busy and since it's funded, and we have been doing several grant-related projects, such as the one that earlier mentioned, and also that we are continuing our using our very effective community health worker or navigator approach to promote the breast and cervical cancer control through the BSAP. And we done the, and people heard about the Detroit and also Flint, the water crisis, which led to the lead poisoning prevention programs that we done in the last 2 years. And we also noticed that violence has been an issue. So we've been promoting the violence awareness in our Asian communities. And last but not least, which I will spend much more times later on to talk about our breast cancer early detection program in China in the second part of the section. Thank you again for having me, and I will turn it back to Ming.
Thank you. So now we actually gonna turn to each of our panelists to share their main message, and we actually asked each of them to cover with a little bit of focus. Dr. Pam, Pam is representing more global perspective, and we asked Sui to talk about their China collaboration, and Su Ying is going to share about their work with Chinese partners. We actually have a special guest coming from Fudan later. And so now, and we also have, they are such deep experts. I feel really bad to keep them at 15 minutes, but you'll see me waving my hand with a 5 minutes warning and a 2 minutes. So again, whenever you are ready, Pam, you please share your screen and lead out into the first topic. And Pam, you can unmute. Great, we can see your slides now.
Okay.
Awesome.
So yes, I think we're ready. Thank you so much. As Min said, I want to set the stage a little bit in terms of appreciating all of the amazing contributions of nurses, and really focus again on the similarity of the issues and the phenomenal contributions of nurses around the world. And so I wanted to start by reinforcing that this is the International Year of the Nurse and Midwife, and I hope everyone has recognized that, even though we certainly had to change our focus this year pretty early on when we realized that, you know, we were focusing on the pandemic, and all of the great celebrations that we anticipated having this year really never came to fruition. So the World Health Organization had already declared that 2020 would be that International Year of the Nurse and Midwife, with support from the International Council of Nurses, the International Confederation of Midwives, the Nursing Now Project, and the UN agency for population. And the key messages of this project were to really focus on how do we strengthen the presence, the contributions of nursing and midwifery around the world, with the ultimate goal of achieving health for all. As you know, the United Nations and the World Health Organization have really focused on trying to reduce the impact of non communicable diseases to be able to achieve the sustainable development goals in all of our countries, with a focus on making sure that we're caring for people in remote areas and the underserved, focusing on things like mental health and aging that are perhaps getting less attention, and reflecting on health as a human right. And so within the campaign to establish 2020 as the International Year of the Nurse and Midwife, there were a number of key messages. So in addition to strengthening our professions, to be able to boost the nursing and midwifery leadership, because we know if nurses are not in leadership positions, their voice is silent. Now you're seeing a number of us on the panel today, or all of us, sorry, all of us on the panel today that have elbowed our way into leadership roles or have been fortunate enough to have been supported by colleagues in order to have that voice and in order to be able to work within our organizations and work across our countries and our international collaborations to be able to make sure that we are influencing healthcare and health services. One of the other goals is to work with governments to say, there has to be political will to be able to support nursing, whether that's helping to establish chief nursing positions in countries or addressing the funding, because many governments control the number of nursing positions as well as the funding flow in order to address education. Now, the five key investment areas that were identified deal with investing more in nurse led services. We know that nurses provide amazing outcomes, and we want them to be able to work to their full potential. We also want countries to employ more nurse specialists, which may also have implications for the educational system. We want to establish that nurses and midwives are central to primary health care and make sure that their services also include supervising community health workers. Also, to make sure that nurses and midwives are intimately involved in health promotion and disease prevention, that's going to make a huge difference in terms of the quality of life and outcomes of individuals, and then to be able to continue to invest in leadership. Part of the work was establishing the State of the World's Nursing Report. This is the first time it's been done for nursing. And so we wanted to be sure that we recognize that it's important to understand the workforce. It's important to have professionals in all locations. It's important for us to support nurses as the key to achieving health for all. You'll remember in 1978, the Alma Ata Declaration said healthcare is a human right. And as we move on to that and look at the Astana Declaration in 2018, it reinforced that we cannot have universal health coverage. We cannot achieve the Sustainable Development Goals unless we have primary health care, and nurses are the primary effector arm for that. Now, we also know that things really changed in the early part of this year. Depending on what part of the world that you're in, you may have had an inkling last December that things were changing as China began to recognize that there was an unusual virus that was affecting people. And then as that began to travel around the world with news in January and then hitting the United States in March, we realized that we were now facing a pandemic, and which was declared by the World Health Organization. But we also know there have been other pandemics associated with the COVID pandemic, and that's those the after effects of really looking at what's been happening. So while COVID itself has been a crisis, the impact on nurses and other healthcare workers has been an exacerbation of the pandemic of burnout. And that is something that we've recognized much more so in the last 5 to 10 years, where about half of all healthcare providers have expressed concerns about their own personal well being, where we've actually seen that stress level skyrocket with COVID. But I want to focus initially on ICN's response to the pandemic, because again, this is an issue of really focusing on what was happening to nurses, not just in one country but around the world. So working closely with the Health Professions Alliance, from the very beginning, ICN began to sound the alarm that nurses needed more personal protective equipment. Unfortunately, we understand this is still happening today in many places, and including some of the locations in the United States, which is truly a priority. ICN also said we have to understand if nurses are getting sick and dying. Collecting those data, it continues to be a real challenge, but we are very concerned that we are protecting nurses. Also, making sure that we're providing updates to all of our countries. ICN has over 130 member countries to be able to keep them informed. We have had regional webinars where countries that have been highly affected, like China and Italy early on, shared their lessons learned. And one of the sadder areas is that nurses have been subject to discrimination and abuse, and we've called on governments to make sure that they are trying to protect the welfare of nurses. Part of that is protecting mental health and making sure that there are solutions to be able to address that. We want to be able to not only have people applauding the courage, but taking action once again to protect nurses. So ICN has been very active working with member countries, making sure that there's been extensive education, being able to advise and have a strong presence in the media and social media, having conversations with governments, linking arms with the World Health Organization to be able to have the most important evidence based information in the hands of nurses, and continue to stress that it is nurses that are really the instrument to be able to not only address the pandemic, but be able to continue to meet the health needs of their communities, while at the same time we know that nurses are experiencing significant stress. So this is what leads us to being concerned about this parallel epidemic of burnout. That there continues to be enormous toll on nurses who have said this is the hardest work they've ever done in their life. It is emotionally draining. It has been difficult to be the surrogate for family members. We also know, again, the fear of bringing COVID home as well as getting sick themselves has been a primary issue around the world. And so being able to couple our impact with making sure nurses have protective equipment with also making sure that there are supports for them for their well-being, resilience, and organizational commitment, and listening to nurses to determine what they need has been incredibly important. Some of the activities that I've been involved in start with the National Academy of Medicine's Action Collaborative on Clinician Wellbeing and Resilience. And going back 4 years ago, we really began to share with the United States in particular the alarming statistics. Over a quarter of nurses have been physically assaulted. A quarter of nurses in intensive care units struggle from post traumatic stress disorder. Physicians have the highest rate of suicide, twice the population. Nurses express twice the amount of stress on a normal basis than the public. A third to a half of nurses and physicians are emotionally exhausted. So these are serious concerns, which again we know have been exacerbated this year. The American Nurses Association has been very active in calling out the concerns about moral distress. Once again, being amplified by the enormous strain of the emotional toll of COVID and caring for patients and families. But moral distress is not new. We know that nurses have often struggled if they've been silenced, if they're not able to have the staffing to provide the level of care they think is important, if they're not able to advocate for patients in a way that the outcome is really what they believe is important and right to do. So for a number of years, the American Nurses Association has said it's really critically important to be able to empower nurses to be able to address the conditions that create moral distress, and more so be able to have the support of leaders in their organizations so that nurses are able to have a healthy work environment and are able to speak up and be able to address these concerns. We know that nurses on the front lines everywhere with COVID have expressed very similar conditions. And while we tend to think that these are local reactions, they're not. One of the surveys that was done of nurses in Wuhan, every single one of the solutions that were proposed, again, really relate to our nurse colleagues no matter where we are. So really making sure that the discrimination is not going to happen, and so that the social status of frontline workers is recognized. And we don't want to call them just heroes. We want to make sure that we are protecting them, empowering them, and giving them the equipment that they need. Making sure that nurses are able to have the staffing that they need. Again, that's not only necessary for patient care, it's necessary for protecting nurses, keeping them safe in these environments, as well as making sure that it contributes to the overall quality of care. Improving the work environment during these very stressful situations. One of the interesting things, you might think it's trivial, but improving the work environment and accommodations such as food. In a similar survey right now with over 30,000 responses that the American Medical Association is conducting, that is actually one of the top solutions that has been identified by all healthcare teams. So I think whether it's a social comfort or recognizing that people just can't get away from these intense environments, to recognize that that's important. So additionally, things like testing, places for people to go and feel safe if they're not welcome at home or in their neighborhoods, but globally all of these support systems are similar. So we do share goals in terms of the international power of nursing and recognition. And one of the ways that the International Council of Nurses amplifies these messages is that every year for International Nurses Day, which is celebrated on the anniversary of Florence Nightingale's birthday in May, we highlight the amazing work of nurses in every country around the world, and focus on how we are raising the voice, how we are influencing healthcare, health policy, getting care to remote areas, to those who would not normally be served, and making sure that uh, message is clear, that nurses address a number of needs across our society. It is not just the traditional work that's done in the hospital. And so there are many case studies that are highlighted. This year, there's been weekly case studies that have continued because it's in the International Year of the Nurse and Midwife. And one of those I just wanted to bring to your attention, that was that one of the case studies on May 5th addressed midwife-led care in Hong Kong, and really a great story. That example, if you want to go and read about it, you can. But it emphasizes how much more psychosocial support and care nurse midwives are able to provide. We know that that's one of the sweet spots for nurses. It is that connection that we have with our patients and families, which is really very, very treasured. As I mentioned before, the State of the World's Nursing Report was done, and it is has been able to point out around the world, once again, we have to be very focused on a health workforce. We have to make sure we have a sufficient number of nurses. We need to make sure that we have the educational systems in place to prepare them. China is not alone in that. The United States really does enjoy the highest nurse ratio in terms of population. And so as we look around the world and look at trying to have similar standards and quality outcomes, we know that we have to work together in order to be able to continue to send those messages. So one of the ways that that's happening is through the Nursing Now campaign, which also is happening simultaneously. And this is an effort funded by the Burdett Trust in collaboration with the World Health Organization and the International Council of Nurses. And it is to raise the visibility and impact of nurses worldwide through leadership development, through collaboration with our governments, through making sure that we are bringing new nurses into leadership positions, and that we are working on the issues most important to our countries. This is a picture of a number of the celebrations that have been held in China, and you can find them from all over the world, where it's been really important to say we are coming together to share and amplify our power. The International Council of Nurses holds a program called Leadership for Change in the People's Republic of China. This project started in 2018, funded by Johnson and Johnson, and so it's been really important. The Chinese Nursing Association has a pledge to bring 500 nurses through the program across 12 provinces. And so it's really been a wonderful way to look at how do we continue to create and produce more nurse leaders. Similarly, in Taiwan, Taiwan's been a leader, one of the first to start the programs in 2015, and they have done, I believe, 4 programs now, but a lot of excitement around the development of leaders, and the Taiwan Nurses Association continues to really set the pace around the world. So I just wanted to stress again that the issues that we share are really worldwide, and they have only been emphasized and amplified in this year of the nurse and midwife, and particularly highlighted through COVID. Nurses are relentless in their ability to serve, and at the same time, we know that we have to improve our visibility. We have to send the messages, not only get the respect, but get the recognition and amplify our voice in terms of making decisions about healthcare in our countries. So together, we will continue to fight all of these issues, and we hope that our international collaboration only gets stronger. So thank you very much.
Thank you, Pam. What a wonderful presentation. I definitely feel the solidarity around the world. I have to confess, my mom was a nurse for a long time before she elbowed her way into leadership role. But yeah, I think the nurses are so important to the healthcare system and to the health of our country and our world. So now I'm going to turn to Sue Lee, who will share a little spotlight on a project they've been working on deep in China.
Thank you, and thank you, Dr. Cipriano, for opening this really great presentation. Just wanted to do a quick check if you can see the slide with no problem.
Yes, looks great. You can actually, the notes to the right, if you want, let's see, there's notes to the right, but if you want to minimize that, that might be even better. Yes, perfect. Thank you.
Thank you. Well, thank you again for the opportunity to talk to you about the work that we are doing at UPMC China and some of the lessons we've been learning and comparative review in terms of nursing practices. With our history and presence in China, we have a lot of great relationship and partnership with top Chinese university medical school, as you can see here. And here in Pittsburgh, we also have a lot of privilege and opportunity to provide clinical research learning and clinical immersion opportunity for physicians, nurses, administrators around the world. One thing to note, even though UPMC China, our office officially opened last year in Shanghai and also in Chengdu, we have a lot of clinical operation presence in China that you can see here in the line chart. We started a lot of our journey with KingMag Diagnostic in terms of the telepathology program. We have also worked with Xiangya Hospital back in 2014, and I have also provided the effort of helping them launching and opening their first international medical center. My colleague, nursing leader, have also lived there in Xiangya and helped to train nurses in China in terms of really closing the gap on some of the practices and adopting a lot of the great practices that we know here. The further pieces of the case study I look forward to talk more is our current collaboration with the Wanda Group in opening 5 hospitals in China. We're also very excited to have a very good strategic partnership with West China University. With the telepathology program, the relationship or the call for action started a while back ago when we are really seeing the impact of shortage of certain subspecialty of pathology in China that really led to the unfortunate of sometimes misdiagnosis or underdiagnosis for certain tissues that really led to the inability to provide a very precise cancer treatment. Dr. Chow, as you can see here on the slide, really jumped into the action and working with various disciplines, including IT, to figure out a way in terms of how can we help. So we have definitely worked with a lot of partnership and expert in China to develop a real-time telepathology system where the pathologists around different parts of the country have access to UPMC pathology department 24/7, where they can immediately get a second opinion when they look at the tissue sample to render an immediate diagnosis. So it's not just a second opinion telepathology solution we provide, we also provide just-in-time training to increase the local pathologist's capability in closing that gap. Very excited with our strategic partnership with HAAP, or West China Hospital Sichuan University. We have engaged in various educational partnerships, including the recent e-conferences in sport medicine. as well as the nursing participation from the School of Nursing, talking about the various nursing clinical research at the Huaxi Nursing Annual International Conferences. Right in the middle, it was the last visit that I get to have before the pandemic at Huaxi. We have been brainstorming of things that we can do together when it comes to nursing education partnership, as well as some of the future hospital UPMC will be opening in Chengdu and various city can be a great clinical rotation site for the nurses in China as well. With the pandemic, that's definitely just like, what you heard from Dr. Cipriano earlier, it's a challenge. It is a global challenge. At the beginning of the pandemic, in the beginning of January, when the outbreak is really hitting China, I had the privilege to work with our team here to figure out a way in US and Italy to try to procure PPE and send it over to Wuhan. We were able to work with our Brothers Projects Foundation in Pittsburgh in shipping a significant amount of PPE to Hubei. At the same time, when the pandemic started to shift to the Europe and impacting our Italian hospital, when our transplant hospital was asked by the Sicilian government to immediately convert our ICU to be a special severe COVID-19 management ICU, we realized we don't have enough PPE and ventilators and ECMO machine and various equipment to take care of the patient. We were very fortunate to have a great team of physicians and supply chain and nurses in China that was able to help us through the various relationship to immediately look at what's available in China when China is slowly getting back to the norm in procuring significant tons of PPE and equipment and shipping to the Sicilian government and community and able to meet the needs of the Italian population. The other thing that we have the opportunity to do at the very beginning of this crisis, we are fortunate to have a formal UPMC intensivist physician who's currently the intensivist director in the Wuhan, which is the epicenter of the crisis at the beginning. And Dr. Zhi Yongpeng was really great in jumping on the call when US started experiencing the surge of COVID and talking to clinicians about his experience. As simple as things like, how would you intubate the patient differently while protecting yourself? How effective is the medication management, the intubation algorithm looks like? And those are the experiences we're able to do in terms of going through this crisis together. In terms of the exciting part about the future of healthcare and how this specific project I've been involved day in and day out has not really impacted a whole lot by COVID. We find ways to continue the exciting project that we have. Last year in 2019, UPMC, along with our investor partnership Wanda Group, signed a significant long-term 20 years contract in the vision of developing an international medical network in China, of building this 5 hospitals across the country. We've been actively working nonstop through the crisis in terms of like making sure our construction for the first hospital in Chengdu is not delayed. This Chengdu hospital that we've been working on would be a 500 tertiary hospital in the new Tianfu region of Chengdu and aim to open a little bit shy 2 years from now, June 2022. Previously, before the pandemic, I was able to travel back and forth in terms of leading the on-the-ground operation, and personally was impacted by the pandemic and the fact that I'm technically supposed to be living in China and leading the operation on the ground, and that's unfortunately a little delayed. But nonetheless, the collaboration's really not impacted because the virtual working and having the boots on the ground team has really been tremendous. One of the distinctive feature of the hospital and the medical network we aim to build is this will be the very first private hospital in China managed by a top US academic medical center. And one thing that we really excited and look forward to enable is China and the healthcare professional can be part of this global network that span between US, Europe, and Asia. This first hospital in Chengdu will be among the first private 3A hospital in Chengdu, or the Chinese highest recognition, 三甲医院, that's not easy to achieve. And we have been learning a lot in the various requirements of the VA hospital in terms of designing the hospital, in terms of designing the clinical specialty to meet that demands. Joint Commission International Standard will definitely be the fundamental standards in setting the safety operations and expectation and how we deliver the care. It is also the hospital vision and operation to achieve that accreditation when it opened. When we designed the electronic medical record and operation system, we use the highest level of standards from HIMSS to guide our design, and again, hope to achieve the HIMSS ERAN certification when the hospital opened. And the hospital will be also providing innovative care that currently is not as easy and available in Chengdu, such as being the stroke center and being the Heart and Vascular Institute in the Chengdu region. We hope to through that level of care, we'll be able to also achieve international level of certifications of quality. And one of the really eye-opening experience for me is not only learning about various Chinese facility code and design, but also what's exciting to work with an international team is really use an evidence-based approach. When we look at the design of the clinical space and workflow to make sure we use the best level of standard in designing a sustainable environment that is going to promote a patient-centered care workspace for our clinician. I was pretty excited about a month and a half ago receiving the first glimpse of interior design photos of the hospital. We've been working so hard for the past year and more in designing the technical clinical requirement for this 500-bed hospital. How many operating rooms are we going to have? How do we design each of the room and the equipment selection? It's really exciting to see that the same emphasis also going into the patient experience to create an environment that we can really engage family as part of the care processing. Besides the technical specification you see here, we also envision this is not just a hospital, but this is also going to be the training center for the future nurses, physician providers in China. So a lot of investment has also put into designing simulation lab in the hospital and various telementoring in the surgical and various clinical space to be able to have an international network of experts to be in the room with the clinician at the point of care. We are also learning a lot in terms of how to incorporate what's great in China, such as the traditional Chinese medicine and the maturity of how the TCM can be part of the care. So we have a significant specialty that is also dedicated to TCM for inpatient and outpatient services. And the other thing that I think in US has a lot to learn from China is the emphasis of well care. So part of the design of the hospital, we have a significant department that designed to the well care wellness program, health checkup center, and health coach program as well. One of the things that as we going into the project, we definitely understand the challenges of nurses in China. Just like Dr. Cipriano said earlier, it's really not unique to US or any part. It's pretty global and commonly shared around the world when it comes to nursing shortage, working condition, and perception of nurses, as this 2018 Lancet article highlighted. And we are learning to see how can we turn those challenges into opportunity in terms of this project that we do in promoting nursing. So one of the things that I think we all know as nurses, nurses are really very creative and genius. Nurses are the master and experts of workaround. If we don't have the tool, we don't have the environment, we make it work. And again, that also kind of speak to the burnout of nurses. Having the opportunity to design a hospital from scratch, the nurse's voice is really important here. So besides working with a multinational team of architect and planner, my job as a chief nurse officer is really making sure the nurse's voice is heard here. In terms of what equipment makes sense, how do we design the clinical space? How does the nursing workstation needs to look like for many aspects to make sure their voice are being heard? I'm very fortunate to have access to nurses around the world that I can ask nurses in the ICU in the US about certain equipment and nurses in Italy. and also very fortunate to have very good colleagues, such as I believe Dr. Wu from Beijing is on the call today, to ask her whether those concepts will work in China in terms of Chinese nurses adopting different ways of doing things. So those voices are being used every day in terms of how we design every single space and every single square inch of the hospital. The other thing that we recognize, nursing shortage, working condition is really impacted by staffing practice. We understand the typical, if not traditional, Chinese practice of staffing methodology is typically looking at one variable of staff to bed ratio that's dictated by the federal requirement. We know that's not enough, especially with the innovative international medical center we're trying to design here. We recognize that the certain care element, certain treatment modality is really new. It's most likely something that most nurses may not be trained to know how to do a good job at. So when we think about staffing, it cannot be one dimensional. It has to be many, many different ways of looking at it. It has to be a really live process that we have to continue to evaluate. So it's a matter of just also looking at the nurse-patient ratio that we know, and like Dr. Cipriano said earlier, US having a best ratio, but the ratio in itself is not enough. We're looking at acuity of the care, the clinical mix that we design for every single unit, the various disease and procedure, but also understanding the scope of practice on nurses in China. Is this something they're allowed to do? Is this something they've been trained to do in China? How would they be able to do this and also be welcomed by the team? And some of the interesting thing by talking to some of the nurses in China, I learned that sometimes even head to toe assessment is not a typical acceptance practice for nurses at the bedside. They tend to defer that kind of assessment to physician, when it's very different in the US that we really value the assessment and nurses being the eyes and the ears of physician and be the first one who detect when the patient deteriorate. Those are the things that we really take into consideration when we think about how do we design the staffing model, and also introducing role that most likely does not exist in this part of the world, especially about the role of respiratory therapy, because it's quite expected oftentimes in public hospital of China that nurses are expected to provide those kind of treatment, versus in the US, you have supporting clinical service line, such as RT, to do those kind of job. The other facts about promoting nurses, which is really important, is the career ladder advancement notion. We understand and also validated with my colleague in China that typically in a public hospital, it's not an easy career path that one can be promoted from a junior entry nurse to a senior nurse. So as you can see here, sometimes it is a tremendous hurdle one have to jump through to take various examinations and go through very rigorous process before you can be granted that promotion. Whereas in China, this Pat Burner 1982 motto from novice to expert is really a second nature to us, especially to UPNC, that not only we embrace this motto, a nursing leader invests into this motto to encourage nurses to continue to advance their career, to continue education, to becoming a specialized nursing to specialty nursing certification, and also promoted to a nursing leader and various leader in the healthcare system in various positions. Overall, I think similar to what Dr. Cipriano said earlier, an ICN recognition of the future of nursing in China, nursing is the biggest workforce or becoming the biggest workforce of the healthcare provider. Their role is beyond just clinical practice at the bedside. I'm really looking forward the UPNC work that we aim to do can continue to elevate Chinese nurses' leadership role in influencing the global health policy and being part of that governance. The future really start with the student nurses. So we're really looking forward to do various education partnership with the School of Nursing around the hospital, as well as the hospital serving as a mean to that education journey and vision and training the future nurses and leaders. It's also very important to the design of the operation model to make sure that nurses are not burned out. They are given the best opportunity to practice at the top of the license. Can we invest having more skill mix that may not be common in China, such as patient care taxis or nursing assistant, so that nurses are not burned out and can be a really good clinical provider partner to physician and to the team. I think I've spoken already about the design to care environment, not making sure nurses is not the afterthought. If not, it's the most important critical input in terms of the user experience and determine how the care environment needs to look like, because they are the key driver and part of the key driver to the patient experience with the amount of time they spend with the patient. And equally important, leadership training. Adopting international recognition program of nurses like Daisy Award is part of the vision we aim to do as well.
So I think we need to speed up a little bit.
Thank you. Getting towards the end, this project that we have been working on, the Wanda Chengdu Hospital, has been really exciting. As you can see here, this groundbreaking photo was taken back in October 28. A little bit a year and a half later, every Monday I get the construction photo. It's very exciting to see the work that we are doing is coming out of the ground. And this photo of this week is showing the constructions on the 5th floor of the hospital. I'm very much looking for the grand opening. It is important for the UPMC to be in China because our visions to make sure that quality world-class care should not be a plane ride away. It should be something that everyone have access to. And our vision is synergistic to the Healthy China 2030. It is our vision to be not only be part of the solution for the healthcare access challenge, but also to train the next generation of healthcare provider. With that, I will end my presentation. That is a video that I will share with Ming after the webinar, where you can have access to see our vision come into life. Thank you.
Thank you, Sue. Given the interest of time, we will make the video available at a later time. And I want to mention that we have scheduled 90 minutes. We know it was not enough time. We will have Sui and Tu-Yin and possibly staying a little bit beyond the 90 minutes. So later after Tu-Yin's presentation and our guest from Fudan, and we will actually first, if you have a question for Dr. Cipriano, that will be the first lineup, right? Because she has to be sharp. So now I'm going to turn to Tu-Yin, and feel free to call in your partner from Fudan anytime, but the floor is yours. Tu-Yin, please feel free to unmute and share your slides.
Good morning again. Hi. So thank you. And then I just need to get to my slides
and just really quick time check. What I've been doing is I send a private chat to our speakers, but they get really busy speaking. So apologize if I'm interrupting later.
Thank you, Ming. You've been doing a great job keeping us on track. And again, it's my pleasure and to share with you in this section that present my perspective as a researcher, that my journeys in the theme of Greater China, US collaborations, and also that giving you a little bit background of the COVID and how COVID is in this region, that because of the times I'm covering the Taiwan portion. So if I could extend to the next slide, that this is a current chart updated, I think 2 days ago. And clearly that we've seen that, well, US, the COVID situations are still kind of, the cases are climbing. And we see that some other regions in the world has been well contained or somewhat restricted. And for Taiwan, that currently the less than only 600 COVID reported cases and very small amount of death. And so your question might be why, Taiwan it can do this. So if you remember that back in 2003, there's a SARS and epidemic, and in the China, Hong Kong, and Taiwan. So since then, that Taiwan has a very well prepared pandemic plan, which could be was developed back then, and now could be expanded to other new pathogens. And since very early on, they have done the border controls to screening all the people coming in, resident or non-residents, as early as the when we think about the timeline, late December, that WHO was informed by the first Wuhan situations, and at that time, Taiwan already started the border control with the screening. And as of about 2 days ago, now that every day coming in, they have to supply a negative testing, no matter if you are, again, resident, non-resident. And because of that, there's two things that also make this very significant, which is the Taiwanese Infectious Control Act 2007, as well as the universal health care system, as you may aware of, that the government are able to link individuals' health claims, insurance claims with their travel history. They're also able to do a very good case management, meaning that for those who are in close contact of infected cases, as well as the traveler from the high-risk areas, that there automatically has to be quarantined 14 days. And this is again very strict, that they are under the they will be monitored by the personal individual smartphone or government dispatch the phone set to make that tracking. And so if you somehow move outside of your quarantine area, you will be notified and get a phone call. This is how strictly it is. And last but not least, I want to talk about mask wearing. This is not regulations that we've seen in the US. You could choose wear or not to wear. It's a culture. So even before this pandemic. As of now, that of November 2020, there's no stringent restrictions of a movement or any national or local lockdown. So I'm going to go very quickly on the next several slides. So there are several measures, and of course I cannot go through them, every single one of them, to reduce the healthcare worker infections as well as patient infections. And also Taiwanese government has done a very early on that they use the government funding and also the military personnel to produce the masks. So the PPE and other issues that we encounter here is not an issue. And I want to point out that another very critical measure, they call the traffic control bundling system, a critical measures that contain and reduce the spread in the hospital world, has been very effectively implemented. And nursing, definitely has played a very, very critical role everywhere worldwide. So in Taiwan, that we see them taking care of patients in the acute care settings, doing screening education in the community for the COVID specific measures for general public. They're in the airport border controls. And so they also transfer patients, Taiwanese resident, back to Taiwan from Wuhan. And so we're definitely paying the tributes to these frontline workers, healthcare worker nurses in particular, and they're risking their lives to save others. And so our deepest, greatest respect and appreciation for them all. So the second part, I'm very glad that I have been able to spend some time to kind of, I see this as a case study. Of course, this is me, and I'm very glad to share with my story with you and how I, as a nurse researcher, to advance the science to improve the health outcomes in the breast cancer early detections. And with the theme today, I'm going to focus on the US Greater China collaboration. before I go any further, I can just think enough of all these and acknowledge all these agencies, including Susan G. Komen for their generous funding. The Eastern Michigan University from day one, they give me the strongest support. And again, I cannot thank enough our president, Dr. Smith, and all the way to the administration, the colleague, the team at EMU. Our community partners in China, the physician, nurses, and also breast cancer survivors. I call them sister because they are true that my sisters that, without them, just don't think I could, be this far. And all the participants that, in working with us and trusted us. So you might think, so we all know that breast cancer is a global health issue. So in China, that we've seen that the prevalence, the incidence is lower. However, we also seen that is on the rise, in between 2012 and 2025 as climbing up. And unfortunately, that we still see in China that most of the women are unfortunately diagnosed at an advanced stage. And that actually, really much, transfer into the survival rates. We've seen that the 5-year survival rate for China is 73%, while that in other like South Korea or is 92%, and US is right in the middle of 89%. And so definitely that the survival rates and poor outcomes that of breast cancer in women that we've seen is an issue and is something that we are addressing here. So using the both qualitative and quantitative research methods really help our team to better understand where they are and getting a more comprehensive picture of their needs and to ultimately deliver a more effective tailored care. So before we done every phase that we always done our homework. So for example, that we are in the phase 4 and we are using a physician intervention to look at the effective intervention outcomes. And so before we can do that, we actually study what their current existing practice of prescribing the screening, ultrasound, mammograms, or other screening methods. And that needs assessment really help us to know our study directions and help us to design the physician intervention activities. The early 2012 study really kind of verify some of the things we've seen earlier in the large statistics, which is that we find in the study that most of the women, they heard about these screening, the breast self-exam or the clinic breast exams and other like mammograms or, the gold standard we're using. But as you can see there, the practice, their uptake is very low. So when we see in the United States, 70% of women had done the mammogram, only less than 25% of them actually had done the mammogram in their, past 5 years, almost like a lifetime. And we also wanted to understand why, the uptake is so low. So the reason, including they don't feel that it's a priority for them, it's not important, they feel fine, they don't need it. And this also shows on the statistics that when we find those women who actually ended up doing mammogram, ended up doing ultrasound, which is much more common in China, is when they are already symptomatic. And so that's very different than what we have here done, that, the mammography or, is used as a screening when there's no symptom and on the regular intervals. And another thing is that we find that they said that they simply don't have information or knowledge in this area. So when we started in phase 1, 2012, that from all the previous study findings, we know that we need to increase the breast health awareness. We need to increase the access. So we work with our multidisciplinary partners, including the government, mayor's office, the city's office, and also recruit and train the medical professionals, the doctors and nurses. And we also recruited breast cancer survivors to become our lay health advisor to deliver these key breast health messages. So in phase 2, that we find that we need to make this evidence-based toolkits that developed by Komen to large greater population. So this is materials that can be obtained in the toolkit, including the PowerPoint slides, the brochures, the breast health cards, the videos. These are all in Chinese. And so, and we use this a very popular QR code, which that I feel we don't use enough in the United States. So we made that available that they could access through this QR code, and then will be widely disseminated. And also our breast health ambassadors or lay health advisors from the cancer survivors, they play an important role in this phase. And these are just some of the materials in the toolkits. So in phase 3, that we realized that because we started in Xi'an in Taiwan, and we realized that this could be widely replicated in larger, because of course, you know, China, they're so huge, you know, in terms of geographic area. So we kind of selected pilot sites, several cities as our pilot sites, and we trained the breast cancer survivors and the nurses to become our breast health ambassadors and to deliver these important work. And right now, as I said, we're in phase 4 because throughout all the 3 phases, we realized that there's a lack of evidence to show that the intervention, the effectiveness of the interventions. So we are using the 2-group design implemented, using the implementation science approach to look, we are trying to examine the efficacy of the evidence-based intervention to see how it improved the early diagnosis of breast cancer outcomes. And this is our video, just about.
longer the video? Sorry. Well, thank you, Suyin, for that wonderful video. Would you like to invite your friend from Fudan to join us briefly? I know we are having only 8 minutes left before we have a little bit of time. Everyone seems to be okay going over a little bit for Q&A. We do want to make sure we answer some questions. We have 2 people raise hands. So Professor Hu, would you like to unmute, turn your video and join the discussion, share briefly your perspective from China?
Okay, I'm very happy to join this webinar, and I really enjoying see the videos from Professor Wu. Remember when we have the conference in Los Angeles, and also all the conference in breast cancer in mainland China, and we have all these collaborations in breast cancer study. So that's really very, very touched. Remember all these beautiful things. And here I would like to share some of our experience of fighting with COVID-19 pandemic in mainland China. So can I just share just some of my slides?
Sure, if you can keep it to
Okay.
about 5 minutes. Sorry for the short.
I can't share. I
Oh,
was not allowed to share. So I will just say something, about our experience of fighting with COVID-19 in mainland China. So
you should be able to share now, sorry.
Okay, it's okay. It seems that I cannot share my screen here.
Well, I think, please give it one last try.
Okay, let me just try again.
While we're waiting, I have to share the video. Looks like the project was in Xi'an. I grew up in Xi'an, so it's really moving to see some of the familiar locations. Yes, we can see your slide now.
Yeah, I can you see my slide?
Yes, we can.
Yeah, so thank you very much. I'd like to, I can't see it now for my.
We're looking at the cover slide.
Okay, let me just, okay. This is just something about just how Chinese nurses in mainland China are fighting with COVID-19. I think earlier this year, it is a really very stressful period of time in the year from February, March, and April. In China at that time, almost 100,000 medical professionals gathering and supporting Wuhan from end of January to April this year. And in that health professionals supporting Wuhan, almost 1/3 of the health professionals are nurses. That account for almost 70% of the frontline medical forces in supporting Wuhan. And at that time, I think it's really a very stressful, but we learn a lot from that special period of time. And all nurses provide humanic care to patients, and also expanded the role of nurse as the triage or detecting or epidemiology survey and infection control professionals, and also provide a lot of innovative, I think I can say that word, innovative ways of patient and a family educator and supporter during that pandemic period of time in Wuhan. And at that time, we advocate that caring with science and also caring with love and art. There is a very touched pictures, photos spread out widely in health professionals in China. Is that word? It is a very touched story. In Wuhan, a doctor accompanied a 87 COVID-19 old patient going for CT scan, and they stop on the way and to enjoying the glorious sunset. Because the patient, they didn't see outside, they didn't see the outside, what is going on outside for almost 1 month, staying in ICU. And it is a very touched moment, and health professionals and patient sharing all these things together with passion and with love. Okay, but during that pandemic, we really learned a lot from this experience that we need to strengthen the nursing workforce, preparing for in numbers and competence of coping with this public health event. And also people are in crisis and they need a lot of psychosocial support, but they don't have during that period of time. But now after I think in the March, April, the government and also hospitals realize that the support to first-line nurses and doctors are so important. So there is a teams of psychosocial support to the first-line doctors and the nurses, and that really help a lot. And even in April and March and in June, there are a lot of activities in advocate or in encourage all these first-line nurses. They're coming back from Wuhan. And every time when they talking about the experience in Wuhan, they cry. I think that's the response of that special event. And the support from the hospital, from the colleagues, and from the government really provide a lot of, I think, a lot of physical and psychosocial, and even their clinic promotion, and also the outstanding award, a lot of ways to support them. I think that really very nice. And also we realize that the training of crisis management is not so good from all these crises. There is many different ways of hospital management, like the mobile hospital, Fangcang Yiyuan, and also the ways to take all the responsibility of one unit in Wuhan, 整建制 management. That's really very special. We don't have that experience, but I think we learn a lot from this experience, how to manage a hospital like a mobile hospital, and how to take the full responsibility of the unit in a very strange, they don't have the experience, they don't know that the environment and also policy and all those, everything is not known, but they really learn a lot from that. My time is over.
Well, thank you. I'm really sorry that we have to cut it short, but since it's really hard to get this group of, deep practitioner together, we do have some audience question, but I want to give each one of you one opportunity to ask a fellow panelist. You got these people you rarely see. Pick one, ask them one question, and then we'll go to the audience question if you can stay on. We only have a few questions. So again, maybe I'll start with Pam. Pam, is there anyone on this panel right now you would like to ask one question first?
One question. So let me ask Suli, what have you found is the biggest challenge in terms of the work environment in China compared to the United States?
I think, Pam, just kind of like along the same line of the theme that you're saying is, we see there's a lot of similarity in terms of the work challenges nurses experience around the world. I would not say that, in general, one is more unique than the other. the challenge that we're really trying to turn it into more opportunity in terms of the culture of the hospital we're trying to build is really position nurses to be able to speak up more and making sure their voices are being heard. Like you hear that from my presentation, we really started with this really groundbreaking work right now, just simply designing, making sure nurses are sitting along with the physician when they talk about designing the operating room. So I think hopefully, again, promoting the nursing expertise and knowledge and teaching them how to have the voice and speaking to the various key stakeholder is really critical in overcoming the various challenges I think nurses have around the world.
Great, thank you. Now I'm going to actually be the moderator. Sorry to cut Professor Hu short, just due to the time. Professor Hu, would you like to ask one of the fellow panelists, pick one, ask one question? Again, if we have time, we can do more of this. I know it's very difficult to get everyone in the same virtual room, so I want to make sure you get a benefit. So who would you like to ask one question, Professor Hu?
Okay. I would like to ask one question to Dr. Pan, because for your presentation, you said a lot of, I think, the ways or chance for collaborations by the ICN, and what Chinese nurse, I think, did not involve a lot in ICN activity. So what is your expectations to Chinese nurses actively involved in that activities in ICN?
Thank you. Actually, the Chinese Nursing Association, the Taiwan Nurses Association are actually very involved. We have board members from both Taiwan as well as People's Republic of China. And so it really is important that the associations want to take the opportunity to participate in activities that ICN holds. And part of that is in sharing experiences through our webinars. Again, we really benefited from hearing from the leaders in Wuhan at the beginning of the pandemic. And similarly, as we look at the leadership opportunities and bringing new leaders on, the commitment to have nurses raise their voice, just as Sulu said, it's part of every country adopting this global agenda. And so having the case studies that shows how nurses in China are addressing the non-communicable diseases, showing how nurses in China are committed to working on issues that affect lower income people or the elderly. And so it's bringing that information together that again underscores, I believe, the solidarity and the message, our commitment to health coverage for all, our commitment to making sure that we are creating health as a human right. But I think as we also look across the organizations, again, as we see nurses doing research in China, as we see the educational institutions, producing scholarly work that needs to be shared, I think it's that similar commitment to saying we want all nurses everywhere to be able to benefit from that great work. And China has many examples.
Great, thank you.
Thank you very much.
Next, Su Yin, would you like to ask one of your fellow panelists one question?
Thank you for the opportunity. And it's a hard kind of, so I wanted to ask from the nursing education perspective that, maybe from Dean Pam and Zed, sorry, I cannot have two. So what are some of the adaptations that we need to better prepare our new generations and new workforce of nursing students during the pandemic?
Some of the things that are really needing to be emphasized right now are adaptability, flexibility, because what we see is when nurses are given the opportunity to adjust their practice, whether that's looking at the roles that contribute to safer care. As we look at nurses made decisions to say, we don't want many people going in and out of the room of a critically ill COVID patient. So the critical care nurse is in the room, but support workers have established ways to give them the supplies they need to convey messages. And all of that was adapted, innovated by nurses. So I think part of what COVID is helping us recognize is that it is time to emphasize again, nurses sort of taking charge of their environment and being able to have control on ways that we innovate delivery models, to be able to work with the established leaders and administrators and other support services to be patient-centered, but also support nursing practice. I think we do that, but I think now we have even more examples of why that's so important. I think one of the other key messages, and I think this is something that you've noticed and looked at in your research, being able to also look at what's happening in the population. We know that Black and brown people have been more adversely affected by COVID. And so sensitizing nurses to be looking at those kinds of issues and be able to identify in our assessments, in our histories, in recognizing the social needs, that nurses can make sure that those are not being ignored. So I think really emphasizing the critical issues that have come to light that we may have reserved for nurses with multiple degrees. We want our nurses on the front lines to be thinking about that as well.
Thank you.
Now, Sue Lee, would you like to pick one panelist, ask one question?
Sure. I'll pick the question that actually we received in our chat box to Dr. Hu about nurse practitioner in China. I think it's in a similar theme. As you can see, I'm really trying to challenge a bit of the status quo of the Chinese nursing school of practice by introducing different care model. As a new nursing leader in this and going into China, what kind of advice would you give me in terms of how to navigate the regulatory landscape in promoting what nurses can do to the mid-level practitioner, advanced practitioners that I've been, and I really cherish that opportunity and able to be part of the care team as part of also the important thing that Dr. Cipriano touched upon, like this evidence to show the direct correlation of a nurse-led care in terms of patient's outcome. How can we be part of the solution? Especially in China, we're seeing access of healthcare is challenging, is continue to be difficult. If we don't think of a different innovative way of care model and different model for nurses, I don't think we can reach a solution to that problem.
Okay, I think that's a very good questions. A nurse practitioner role, actually, we have a lot of studies explore the role of nurse practitioner, but it is still on the way because the policy, the government's policy on the I think the regulation and also their prescription right of prescription referral right, there is no. I think there is no policies support the practice of nurse practitioner in China, still on the way. And there are some studies, like the one of the active study is from Beijing School of Nursing in Beijing University, and also the cooperative with Anhui province. They would like to explore the ways of the policy and also the scope of practice for nurse practitioner. But I think it is still on the way. There are so many barriers for the nurse practitioner role. The major barriers, I think, it is the education level. The level of education of most of the nurses are associate degree. So it is very hard for most of the nurse associate degree, and also the level with a master degree is still not more than 5% all over in China. So that's the major barriers for nurse practitioner role.
Great.
But still on the way, there are some tertiary hospitals. Well, we are explore a modified way, not the way like in US, the MP approach in US. There is explore the special ways like adapt to Chinese situation of, we don't call nurse practitioner, we call specialty nurse. And they have their right and they have the scope of practice, and also they have like mobile internet plus ways to expand their practice scope of practice. I think that's a good models in Chinese situation. if the level of education cannot increase so quick.
Great. Well, thank you. I have a question I have to ask from our nonprofit, right? The elephant in the room is U.S.-China right now, at least on the political level, geopolitically, are in a very hard spot. And I was just wondering, from your professional point of view, what do you see as opportunity for the nursing field of both U.S. and China to collaborate on? That's not political right now. We're not talking about AI. We're not talking about trade. We're talking about taking care of our people. So maybe each of you, maybe starting with Pam, what do you think are the one area that you see great potential for the nurses on both sides, the nursing field from both countries, continue to work together despite of all the rhetoric and things coming from the capital?
Again, I think the pandemic has been the best teacher, being able to share our stories, being able to compare through either research, other surveys, or just case examples. And so I think the more we can contribute to the literature to create those relationships, there are many schools and healthcare delivery organizations like UPMC that have relationships with organizations and nurses in China. And I think to continue to have that active dialogue and compare the success stories, just as we saw in Taiwan, they have been extremely successful, really holding down the rate of infections and then enjoying a very low number of deaths. We need to learn from each other. And I think nurses are good at doing that. We need to, as you said, sort of put the politics aside, because if our focus is the patient, and being able to really look at what the right nursing care is and how we can influence our organizations, I think that's the most important contribution we can make together. And so to share with our colleagues that we have those connections with.
Great, thank you. So maybe Su Li, since you're already deep working with China, in what way do you think that collaboration can become a bigger influence on U.S.-China working together? Where do you see the opportunity?
I think we've been really fortunate that despite politics and pandemic, that working relationship really has been keep getting better and improving. And it's definitely a lot of bi-directional learning. When it comes to technology, sometime in the US, we think this is the best way, this is the best solution. And oftentimes, when I'm having conversation with Chinese nurses, I've been reminded back to the basic care. It's more important as the foundational piece. So I think just having that really open-minded thinking and using, again, like evidence-based approach and really neutralize that perception and be really open to what works the best. Ultimately, what matters is that patient that we serve and do we have evidence of doing things a certain way is really going to yield that outcome that we achieve for. So along the same line of having that dialogue, sharing story, publishing our experience, going up to the policy level and challenging the status quo when we have enough evidence to say that this model does work. We need to think about the healthcare delivery paradigm a little differently and not be afraid to speak up as nurses from a global voice, not just from your country. It's going to be a very powerful messaging that definitely we hope to do to the various projects we have the UPMC, not just designing the hospital, but having conversation at the policy level to really elevate nursing care model as part of the solution.
That's great. I have to say that the story about your project in Chengdu was giving a lot of people hope, because a lot of people, they were like, okay, right now, everything we do China is like have a right sign next to it. So that was very, very heartwarming to hear. So Su-Yin, what would you say, do you see as the biggest opportunity for broader collaboration in the field between US-China, US Greater China?
I certainly is hopeful, and because I try to be positive, even though in our studies that there are so many challenges along the way since the outbreak. But I do agree with Pam that I think, during this pandemic, people becomes more creative and people also work to find ways to work together. And so in the past that, we took students to Taiwan and then Taiwan student came here. But now that, during the summer, we cannot do that. And we kind of take the Zoom way. So I think definitely the sharing, the kind of our faculty ended up doing the Zoom and sharing their the different topics with the students and faculty in Taiwan actually reach out more people and more greater audience. So I do think that as long as that we have we are committed to work together, and nurses are innovators, and so we will find a way to moving forward.
Great, thank you. And Professor Hu, coming from Shanghai, what do you see as the way U.S.-China can continue to collaborate in your field?
Yes, I fully agree with all of Professor Wu and Sue and Dr. Pam's point of view that even there is pandemic, but the collaboration and sharing never stop. We use different ways. We create different kind of innovative ways. So we still very actively have collaboration with partners in US and in like Australia and also in Thailand. So, and tomorrow we were going to have a very big symposium. We collaborated with Flinders University in Australia. And also we also invite Professor Marianne Bloom from Duke University, the Dean from Duke University, and also Professor Wendy Gifford from Heartland University Nursing Schools to join. So I think still very active, and still for student exchange, we create like a online exchange for students. Like we have a just last week we have a very successful exchange for our undergraduate students in Fudan University Nursing School and 5 undergraduate nursing students in Duke Nursing School, and they using case study online and use like these Zoom meetings every week. And very successful and very creative, and the sharing the culture point of view on like one case, and that's very successful. I think it is compared with the traditional ways, it is cost effective and it is convenient and it is very effective. So we can see the positive part of this pandemic create so many difficulties, but positive part as well.
Well, thank you so much for helping us to end on such a positive, hopeful note. And again, I really want to thank you. I know we went way over time, but it's such a pleasure to meet all of you, hear your story. I definitely see a lot of collaboration coming up, learn so much. But again, we're here to promote collaboration. So if you have a story to share, if you have ideas, you want us to help with connection, any way we can help, we're here. Thank you so much, and I hope you have a great rest of your day. And Professor Hu, have a good evening in Shanghai. And
Thank
now
you.
we close this program. Thanks, bye-bye.
Thank you.